everyone, I'm Dr. Tammy Nelson, and welcome to my author interview with some of my co-authors for my new book, Integrative Sex and Couples Therapy. This is a therapist's guide to new and innovative approaches. And today you get a special bonus. It's 2 for 1. We have the authors of the chapter, and I'm going to tell you the exact title so I don't mess it up. The title is Sex Therapy and Sexual Medicine with Couples, the Collaborative Sexual Wellness Model. It's chapter 2. It's towards the front because it's super important. So we have the authors with us today, Daniel Rosen and his wife, Dr. Pebble Kranz. So thank you so much for joining us.
Thank you. We're delighted to be a part of this.
We are.
I love the book, even though I'm the editor and author, because the contributions are amazing. What you guys wrote was really fascinating. I love the fact that you're a couple and that you're, a sex and couples therapy experts, and you're like living the actual life and talking about your work.
We try.
We do a lot of talking about work in our personal life.
Yes.
That happens.
Yes. Collaboration in the kitchen.
Oh, I wish I had a video for that.
And we try to set up the boundaries, and then you get oh my God, I forgot to tell you about da 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 da.
Yeah.
So Dan, you're a certified sex therapist and a licensed clinical social worker, and Pebble, you're a medical doctor, a family physician, and a sexual wellness fellow in sexual medicine. Mm-hmm. And you guys have created this collaborative model, and I love how you wrote about it and used cases to describe your work. And you have the Rochester Center for Sexual Wellness. And so can you tell our listeners a little bit about your model and anything that you discovered by writing a little bit more about it in this chapter?
Sure.
Yeah. Well, we found out that collaboration actually is hard to collaborate on a case because doctors and social workers tend to think differently. We have different mindsets around collaboration, around what it is to sort of have a case. So some social workers have 20 cases, and they'll have 20 cases for the year. Other social workers maybe have 100 in a couple of months. But a doctor will have how many cases in a period?
Well, you have a panel of thousands typically. But it's true that, communication styles are different. You ask a medical doctor to present a case, it's a very different sounding case than a therapist presenting a case. And then patient confidentiality is also, there are different protocols and policies about patient confidentiality, which can sometimes make collaboration challenging. A medical doctor might feel like, well, I'm accustomed to talking about the concerns of my patients with a team as a matter of course, and a therapist might feel like I cannot share any details about my patient with somebody, and I don't have specific, explicit permission to do that. So there are some communication barriers that exist, and even for us, with a close personal relationship, we found struggles with regard to sharing care. And I think one of the things that was so interesting about writing the chapter is that it was really clarifying. We got a chance to really understand our model better and reflect on some of our clinical successes together. So it was really helpful to think through the model the way that the chapter led us to.
I think if we hadn't written this, we wouldn't have done any research on collaboration. We would have done our research on how to be a good sex therapist and traveling to Europe to be a sexual medicine specialist, but we wouldn't have looked at collaboration specifically.
And I was really lucky to be trained in a program at the University of Rochester that deeply values collaboration. In fact, the Department of Family Medicine has family medicine residents working right alongside marriage and family therapy trainees actively teaching the value of collaboration between medical and mental health providers, and really thinking through the value not only of collaboration, but of a co-located, integrated team. So it was sort of inevitable that we would be working towards a collaborative, integrated model for the care of sexual concerns for individuals and in relationships and a medical perspective.
So what would you suggest to people who want to work more collaboratively? Maybe they don't, they're not married to a doctor or a therapist, but they want to integrate sex therapy and relationship therapy, and they'd also like to integrate the sexual wellness medicine model as well. Like they want to work with different practitioners. Like what would be your advice to people starting out, or even to advanced clinicians?
I think that people look at starting out as a disadvantage. I think people think, oh, I'm behind, I don't have the experience. And really you have the wonderful opportunity to mold yourself to the other providers that you're going to be working with. A new provider is someone that is really eager and earnest. And so finding a physician, a urologist, a family doctor who wants to have somebody that is willing to take the time and work with them and listen to them, I think there's an advantage there, as opposed to being more set in your ways and thinking that you sort of know how to do it. Growing up together with another provider can be really helpful.
Yeah. I also think that sometimes therapists think that doctors don't value their input. Mm-hmm. And my experience is that by and large, physicians are really grateful to have a team member in caring for clients. And while we're not always the best communicators, we do want to hear from therapists, and we want to hear your experiences. So that I would encourage people to reach out to the doctors who their clients are working with and be willing to communicate.
I think developing trust, especially on the sexual issues, you want to have trust. And obviously that's the gift that we have being a couple. But what it told me is how important that is. And it might take more time to develop a relationship. And I don't know, how would it be for a clinician to say, I really want to get to know you better so I can be honest about the people, my cases, to really try to open up about that.
I think that is valuable. I think that people want to be able to speak frankly and learn what another specialist has to offer. We're accustomed to that in medicine. We're accustomed to going to another specialist and saying, I'm really confused about what's going on with this client. Can you help me figure out, help think with me about what's going on here? It's a part of our training to do that kind of consultation with other specialists.
That's interesting, because I think a lot of therapists are intimidated by medical doctors, and they're afraid, to collaborate or to ask questions or to reach out, because the medical professional has always been the boss. Now, I know all our readers want to know, between the two of you, who's the boss. And so you're going to have to come clean, because whether you're talking about your clinic or at home, I don't know, but
the clinic is the home.
Yeah. So I think that that tendency to think of doctors as the boss is a real barrier. And a lot of doctors don't think of themselves that way, but then there are a lot who do. So that is complicated. And then there's the extra complication of how doctors tend to receive communications. Often communications in medicine are one way, they're informational. So you get a consult note from a specialist that is informational, and you're not expecting to communicate back.
Right.
And so unless there's a specific request for specific information, a doctor may not know that you want something, that you want more of a conversation.
That's a good point. Yeah.
But I'm going to indulge your question about who's the boss.
Oh, good.
And the answer is right in front of you. In the title of our model is the collaborative sexual wellness model. And so what I really like about working with Pebble is that we each value each other's opinion, and it doesn't feel like one of us trumps the other one, that we're working together. And I think in the chapter, Pebble called it non-hierarchical.
That's
which
nice.
is really nice.
Yeah, that's really nice. And I think that's a great example for other therapists and for readers too, particularly, and for clients, you know, people that are coming in to get help. I think they need to see that as well.
Yeah, we don't have to feel like we have to defend our turf. So that's going to be turf defending is going to interfere with really being able to collaborate well with somebody.
Yeah, totally. I totally love that. And so what advice would you have for people who might want to seek out services like yours, or, you know, not just the therapist, but anyone who's looking for help? I see a lot of people who could use your model, but maybe don't have access to it. And I notice in your chapter that a big part of what you do is a big assessment. Like you both really take a really thorough history and assessment when people come in.
Mm-hmm.
So 2 questions in one. How do we, what's advice for people who are looking for help? 3.
All the questions.
There's like 4 or 5 in there, maybe a whole bunch.
You know, what's the song, Tammy? You better shop around.
Mm-hmm.
I have a philosophy that when therapy doesn't work, it's never the client's fault.
Oh, interesting. Yeah.
It's always the therapist's fault. And the evidence is that some therapists are better with some people than others.
Mm-hmm.
All right. There's some people who wouldn't know what to do with a highly educated type A personality physician. And they're like, give me someone who's really down on their luck, because I can't relate to those other people. There's other people who are the exact opposite. Mm-hmm. So shop around. There's plenty of physicians, and maybe less physicians, but there are plenty of therapists, especially in the age of teletherapy. This has really unlocked the potential for people. You are not stuck with the person at the corner down the street from you. Mm-hmm. And so you have to find a good fit. All the research, right? All the research says there has to be a good fit. And there's no research that says sorry, Tammy, the more experienced you are, the better you are.
What are you trying to say?
No, I'm saying what I'm saying.
All those degrees are worth nothing now? All those letters?
You've supervised. I know you've supervised tons of people, and you've seen really green supervisees who are doing incredible work.
Oh, totally. It's very
incredible, mind-blowing work right out of the gate.
Absolutely.
And so that's right. So we want to help. We want to empower people to find somebody that's going to work with them. And we've both had cases where people came. They were in a not helpful therapeutic relationship for God knows how long prior to coming to see us.
Yeah, that's true. I think people see an average of like 3 couples therapists before they finally settle on one that they really like.
I think as far as finding a sexual medicine physician goes, it's challenging.
I don't know any except you.
Well, there's more than just me. One of the challenges is that sexual medicine physicians don't have a certifying body here in the United States the way they do in Europe, which is part of the reason that I went to that training, where they take physicians from a wide variety of specialties and put them in the room with the psychologists who are sex therapists, and they expect all those people to have the same body of knowledge and certified to provide service to people for sexual concerns. And so we don't have that in the United States, but we do have some fantastic organizations like the International Society for the Study of Women's Sexual Health, ISWISH, that has a list of professionals. They have a fellowship program as well. And then also Sexual Medicine Society of North America. You know, at least the people on the Sexual Medicine Society of North America's list are interested in sexual issues. You know, at least they're interested, even if they haven't had wide training.
Mm-hmm.
And then and then there are, of course, an increasing number of the fellows of the European Committee on Sexual Medicine, which is the fellowship that I did here in the United States. I do consultations, clinical consultations for sex therapists who are anywhere. If you want to call me up and talk for a half hour, an hour about the concerns of your clients and understand their sexual concerns from a medical standpoint, I do that.
That's good to know. We'll make sure we get your information before we end, so
Okay.
people can contact you. That's really good. That's a great service.
Great.
Yeah. What can you leave our listeners with that might be important as an exercise or an intervention or a tip if they're short on time and short on cash and they need some help, they need some intervention today?
Like you're already, people already in treatment somehow?
Or just they pick up the book and say, wow, this is so interesting, and now I know I have a sexual issue and I need some help, but I can't get out and I can't get to the doctor yet. And what would you recommend?
Oh yeah, well, look, one of the things that seems to happen with people is they have a sexual problem and they don't say anything about it. They sit on it and they don't worry about it. They don't talk about it, and then they tell their partner, well, maybe we should da 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 da. And from the partner's perspective, they're like, oh, maybe one day we'll get to that. But by the time, right, Tammy, by the time the person said it, they're like, if we don't deal with this yesterday, I'm out of here, or
Totally
something
true.
like that.
Mm-hmm.
So when your partner says, even hints, let's think about sex, jump on that right away.
So to speak.
So no, not so.
In all ways that you can. Yeah.
Depends. Really.
I guess there's one of the things. So writing this chapter, we did some reading for it, and I found this model. Erwin Goldstein's one of the authors. It's listed in the chapter of when a person is having sexual pain, and I generalize this to sexual distress. There's 3 stances that a partner can take to that. One stance is this sort of aggressive, hostile response. Oh God, what's wrong with you? Why don't you do that? And the other response, this is the tricky one, right? For the nice people, is over-accommodating. Oh, it hurts. I'll never ask you again.
Mm-hmm.
Oh, you're not interested. We'll never try again. And the third response, facilitative. Remember that word. How do we help couples facilitate and have these complex, difficult conversations to engage in and to improve the sexual relationship? Of all the stuff I read, the content of that was a really brilliant synthesis for me about how to think about helping couples negotiate sexual problems.
Right, to stay connected even when there's problems, and
Right.
and yet say, I'm here for you, let's work this out, I'm not going anywhere, we'll figure it out together.
I want to be sexual with you. A partner saying, I want to be sexual with you, even when it's difficult, can be really healing.
Yeah, that's really important. That's really great. And I think that's great advice for our listeners and for our readers and for other therapists to take into their sessions with them as well. Yeah.
Yes.
So how can people find out more about you guys and your work and online sessions and consultations? How do they find you?
www.rochestercenterforsexualwellness.com. We have 2 certified sex therapists who are doing supervision. We have a supervisor in training, and we have a certified supervisor, as well as consultation with me, and people through the website can request information both on professional consultation as well as patient or client consultation.
We are unveiling our upgraded website, which my darling spouse and business partner has put endless hours. So we've really turned our website not just into how to make an appointment with us, but it's a wealth of information, endless hours, really trying to put clinically relevant, try this first. You've got a sexual problem, you've got a little button. Try this first if you're anxious about making an appointment.
Oh, that's so generous of you. I really appreciate that about you guys. That you really give out good information. You're super generous with your advice and your work. And it says a lot about who you are as clinicians, but who you are as a couple as well.
Yeah. We like to make people feel that they're living their whole life. like, "Ugh, that's not the right thing."
Yeah.
They know what you
Cut
mean, though.
that part.
They know what you mean.
We want people to feel like they're them whole selves.
Their whole self.
Their whole selves.
You're right.
And also we're both very committed to not only safe but evidence-based practice and things that we know through research are effective. I don't sell any medicines or procedures in my practice. We talk about the options and we figure out what's most likely to be helpful to people.
Well, I think that goes to our whole theme here, which is integrative sex and couples therapy.
That's right.
You look
Right.
at the whole, you really believe that people should, live their whole best lives.
And we consult and collaborate with people like you who are really working to bring the field of sex therapy and couples therapy together and end the rift. The rift just has to end, and I know you're so dedicated to that, and it's really been helpful for us as to emulate that and grow our practice.
Yeah, we're
thank
so
you.
appreciative of you.
Thank you. And thank you both for being part of that mission and to change the face of psychotherapy so everyone could be certified as a sex and couples therapist. And I really, really appreciate your time. And for those of you who are watching and listening, you can find out more about Dan Rosen and Dr. Pebble Krantz. And you can read their chapter in Integrative Sex and Couples Therapy. You can buy the book anywhere books are sold, including Amazon. You can also find it at Pesci Publishing and Media. To find out more about them, you can go to Rochester Center for Sexual Wellness.com.
That's
Correct.
right.
And or you can write to me at Tammy at drtammynelson.com. To find out more about training as a sex and couples therapist, you can go to istitraining.com. That's the Integrative Sex Therapy Institute, ISTI training.com. And we're happy to tell you more about our training. And also, Dan and Pebble are teaching, and they're instructors at the Institute. So we can tell you more about courses both online and hopefully someday in person. So thanks again for joining us. I'm thrilled to have you. Again, this is Dr. Tammy Nelson. Check me out on my podcast, The Trouble with Sex. Check out our YouTube channel and go to the website, istitraining.com. Thanks again, people. Bye-bye.
Thank you.
Thank you.